Hey everybody, welcome back to my channel, and here we are for my 22-month hormone replacement therapy update. Holy shit, we're just 2 months shy of hitting 2 years. I can't even begin to believe that. It's absolutely mind-boggling. These 2 years have flown by. I mean, at the same time, they've gone so slowly, don't get me wrong, every day watching myself, looking at myself in the mirror and picking apart the most minute little changes, especially early on. It has been really difficult to be patient through all of that. But now here, 22 months later, it's like that time has flown by and I barely remember the time before I was on hormones. It's really weird. It's like I remember it. Don't get me wrong. It's not like I've lost my memories, but it's just foggier. And like I was getting at last time I was here talking about it, it's just like I'm kind of removed from those memories and I don't really feel attached to those memories as much. There are some pictures back over here behind me of me playing baseball, and it's like I can look at those and I can know that that's a picture of me, but it doesn't look like me. The guy in that picture does not feel like me. That's a very weird experience. Anyway, weirdness aside, I wanted to address something that I've not really been an advocate for before, but I decided to do this past December. So there were some issues with my endocrinologist and being able to get appointments because they were on leave, and it was going to be 7 months after my year follow-up should have been that I could have been seen. So I went to a new physician's office and started with a physician assistant there. They were able to transfer over my HRT, up my dose a little bit, and it's been held pretty stagnant since that year point. And I would love to increase my prescribed dose. Or at the very least add progesterone in. That's something that I talked with my endocrinologist about wanting to do. They discussed with me that there's not really much objective evidence, even though there might be some anecdotal evidence for the use of progesterone. But from my understanding as a med student when I was studying development, progesterone, especially during pregnancy, is that tipping point that completes breast development, if you will. So I'm thinking that progesterone might help to complete breast development, so to speak. That said, don't know when necessarily it should be introduced, so I'm going to talk to my doctor about that. I actually have an appointment coming up in 9 days, so I'm really looking forward to discussing that and seeing if we might be able to change my regimen because, like I said, it's been pretty stagnant for a while. Now, that said, in December, the pharmacy was not going to be able to get my 10 milligram per milliliter estrogen vial because it was on back order and they were closing for the holidays. So it was like, what do I do? And the pharmacist, being super cool, she has helped me out a ton in the past when I've had issues. She decides to just give me a vial of the 20 milligram per milliliter. And so it was double the concentration and I only needed to do half the amount of injections. So I'd been doing 0.6 milliliters or 6 milligrams. So we were going to do 0.3 milliliters for the same 6 milligrams. That said, I kind of took it into my own hands a little bit. I decided to inject 0.4 milliliters. So I've been doing 8 milligrams a week for the last, 5 weeks or so. Honestly, I like it better. I felt my boobs grow more, and you can see, they're looking pretty good these days. They look like boobs on both sides. This one's definitely still a little smaller, but that said, I definitely have felt them both growing significantly more since I decided to up my own dose. So I'm not advocating for not listening to your doctors, but plenty of people do DIY. As long as you're sourcing from safe suppliers, in theory, You should be okay. Just don't overdo it. Incremental steps if you're gonna go by that route. Like I made such a slight little change. And even that, we're gonna see, like, now after almost a month and a half of me doing that, what effects has it had? Because I had blood work right before that, and I'm gonna get some blood work after this doctor's appointment. So we'll see how that's doing. They may tell me that I need to not do that. I don't know. We'll see what they want me to do. Regardless, I'm kind of glad that I did, because again, it's given me some better breast growth. I feel like it has helped my mood. The breasts definitely help with the dysphoria. And so in that same time, since I started upping my dosage, I don't think I've been misgendered once. I honestly can't remember the last time I was misgendered. I think it was while I was still working my retail job, so we're definitely talking like before Thanksgiving. And yeah, I mean, that's great. Like 3 months basically without being misgendered, and that's including on the phone, which I'm so happy about that. I can't even begin to tell you. So shout out Yumish for helping me get vocal therapy and really not incurring too many costs to me for that. So I really appreciate you. Yeah, it's pretty great to not be misgendered and for people to see me as the woman that I feel I am, and I know I am. So I'm really happy about that. And to that end, in pursuing my transition fully to the extent that I would like to, obviously surgery is not for everybody, but I've decided probably about as of a year ago that I definitely do want to pursue bottom surgery for myself. I don't know about any other surgeries. I feel like I don't really need facial feminization surgery at this point because HRT's given me changes that I'm pretty satisfied with. Breast augmentation, I don't know. Maybe I feel like there's still plenty of more room to grow, so we'll see what happens there, especially if I add in the progesterone. But bottom surgery, I know that's not something that's going to change because of the hormones. So that's definitely something that's on my list of stuff to do. And I finally got motivated to start looking into it more fully because I started feeling a lot of really intense bottom dysphoria over the course of the last month and a half or so, probably about the time that I changed my hormone dosage. And I don't know if the two are related or if it's just that I have gotten to a point where I am no longer satisfied with the parts I was born with. But whatever it is, I feel this intense need to pursue bottom surgery and to do so as quickly as I possibly can because it's getting to a point where that dysphoria is kind of overwhelming. And not only does it make me feel less satisfied and happy with, say, my reflection in the mirror when I get out of the shower, or, you know, if I'm being intimate with my boyfriend, like those sorts of things can become uncomfortable because of the dysphoria. And it has nothing to do with the person that I'm with or changes in me physically at that point. It's just like mentally, I'm no longer satisfied with my body not being completely aligned with the sex that I want it to be aligned with. And so I've decided that vaginoplasty, bottom surgery, is the right course of action for me. And because my family lives in New York, pretty near New York City, I decided Mount Sinai was a pretty good place for me to go, especially considering they have some health records from when I was an employee there. So it was very easy for me to get into their system and get some paperwork filled out and started. And they were great. Like, I would like to get my surgery with Dr. Bella Avanesian, and I found her because of the Reddit r/transgender surgeries, and she was putting out what I think are some pretty good results. And these are results that other patients, other trans women have posted because they would like to share with the community what is achievable. And I think a big thing that was holding me back from pursuing the bottom surgery before was fears about outcomes and myths surrounding what that neo-vagina is like. And the truth is, a lot of the times, these trans women who have had bottom surgery are able to have almost fully functional vaginas that maintain pH and have colonized bacteria are able to essentially flush themselves and clean themselves. Like, it takes time to get there. Dilation, it's not something that has to constantly be done throughout life. You just have to do it regularly for the healing period, and as long as you're sexually active, you shouldn't have to dilate too often or regularly. So there's a whole lot that I did not know or had qualms with going into thinking about bottom surgery that made me hesitant to pursue it before. And it's just like, there's so many really happy girls from the results that they've gotten with these surgeries because the techniques have advanced. There are tunica grafts for penile inversion. There's the peritoneal pull-through method. There's the sigmoid colon vaginoplasty, even using grafts from the jejunum and other parts of the intestines to give you that mucosal lining that produces lubrication, if you will, moisture. And so it's pretty amazing what's possible. And Dr. Avanesian seems to have some good aesthetic results relative to what I would like to have for myself, as well as functional results. And so the women that have gone to her seem to be pretty pleased with how their vaginas work after the fact. And so I think that with all those factors brought together, Mount Sinai is going to be a good hospital for me. So I reached out to them, and within 48 hours, someone was getting in touch with me to send me paperwork and to start explaining what I need to do and the steps that will need to be taken. And essentially, the first step after that was setting me up with a social worker. So Mount Sinai, they're within maybe 3 weeks of that first phone call, they had someone reach out to me from scheduling. They scheduled me for a social worker appointment this past Wednesday, and they had called on Monday. So it was a 2-day gap. So that was really great. It's just moving right along. And then the social worker kind of blew my mind. She informed me that the next step was going to be a consult in 2 to 3 months. And I expected maybe a little bit longer of a timeline to that consult even. I was expecting it to be like maybe have to wait over a year to get in the door just for a consult, because that's a lot of what I've heard. And to know that that's not going to be the case is really a huge weight off of my shoulders, because it's like, oh my God, this is actually feasible within like maybe the next year and a half. And then she goes on to tell me that from our conversation on Wednesday, 8 to 12 months is the timeline to surgery. What? 8 to 12 months? I was expecting minimum 2 years. Like 2.5 years average, probably, was my expectation when I was going into this process. And to be told that it's more likely to happen within 8 to 12 months from 3 weeks after I made my first phone call. That's kind of mind-boggling and a little bit daunting, but also super, super exciting. And I can't even tell you how quickly I want the rest of this semester to pass by so we can get to the end of April and I can go back to New York to do that consult and get this all moving, because I want my vagina. So there's that. And I figure I will just keep you guys apprised as I learn more about the process. I was looking into my insurance and what's going to be the case with that, because I'm on Medicaid for the state of Michigan. So I know that they're supposed to cover gender-affirming care and procedures, but I don't know to what extent they will. And I really don't know if they're going to cover a procedure by a surgeon in the state of New York. So that's a concern, of course. The social workers seem to make it appear as though my consult is going to be a time where they're going to provide letters for mental health evaluation and a physical evaluation, and my endocrinologist will have a letter. So I'll have plenty of letters from physicians and surgeons and mental health professionals that are required. I think with Blue Cross Complete of Michigan, which is my Medicaid plan, they only actually require 1 letter. However, the more you have, the better your case. And again, I think with the New York, my parents being there, them being able to help out with recovery for the 1 month of recovery time that I have to stay in the state where my surgery was and near the hospital, I think that's going to work out very well. So all that said, I think that it's likely I will get the authorization. It's just a matter of, do I have to do that, or is the social worker going to do it for me? So I need to clarify that. But it does seem like they're going to advocate on my behalf quite a bit. So that's great. And I was told, like, again, within 2 weeks from my phone call, I should be getting the phone call about scheduling that consult. And I'm really just looking forward to that at this point so I can start moving forwards even further. Having done hair removal, I'm at an advantage where I don't have to go through, say, a year of electrolysis like many women have to do before they get surgery, because at the time of consult, they'll be told, like, hey, there's too many hair follicles here. We need you to take care of it. That's another great thing. Mount Sinai, if you have not done the hair removal, they will set you up for hair removal with them at, I don't remember if it was additional cost or just part of the whole what's covered for surgery requirements. Regardless, like, they have everything in-house. And I've heard good things, I've heard some not good things. I tend to think that the good things are probably more indicative of how care is being provided, and the not so good things are probably more case by case, where it's like, this person wasn't necessarily satisfied with the results. And I'm not blaming the patients whatsoever, but I am saying that your mileage may vary. That's just true of transitioning. Not every person's going to have the same experience. So far, things have gone well for me with transitioning. I have a good BMI relative to what's recommended for surgeries. So hopefully with all that, my body's in good health to recover properly and get the outcomes that I'm looking to get. So yeah. With that said, I think that really takes care of the bulk of what I wanted to talk about in these updates. Another thing was mental health. So mental health is a real serious consideration when you're transitioning. It's a difficult thing to do, to change your gender. Not just to do it medically, but to do it socially, to maintain relationships if there are people in your life that are supportive. If not, cutting those people out and losing people that were supportive in your life. All of that's really difficult, and it can take a huge toll on your mental health, and you might not even realize just how much you're suffering. And I don't know how long I have been depressed, but I've been depressed for quite some time. And I started an antidepressant January 5th or 4th, something like that. And it's called Auvelity. It's a recently approved antidepressant. It works on glutamate pathways, and it's supposed to be fast-acting, with 17% of patients seeing improvements in their depressive symptoms within the first week. Within a few days, I definitely felt some improvements. I felt a brightening of my senses, and generally just my whole mood is so much better. I have motivation to go about my daily tasks. My dishes are staying clean. My homework, I was done with all of my homework for the week on Monday. Like, I haven't done that since high school. So, to feel this good about being able to get stuff done, it takes a huge load off, because there was anxiety relating to all the stuff that I would let pile up. And now, being able to stay on top of things, I just really don't have that anxiety as much anymore, and it's really nice. So, I encourage you, if you can, please try to take care of your mental health. If you're not in therapy, be in therapy. If you're in therapy and it doesn't feel like it's enough for you, psychiatry may be necessary, and that's okay. There's no shame in being on medication for your mental health needs, because at the end of the day, when you feel better, it's going to make a world of difference in what you're able to do in your day-to-day, and you're going to forget that you ever had qualms about medication in the first place. So, with that happy note, I will leave it off there. I want you all to just enjoy the next couple of months until I come back with my 2-year update in the end of March. So yeah, I'm not going to come back for the next couple of months just because I want to take my own little break. I want to focus on school, focus on earning some money, and focus on my boyfriend. So that's what I'm going to do, and I will catch you guys in the next one. Bye, lovelies.